Hi everyone. Thanks for being here today. It's a great honor to come here and to speak to you a little bit about the work that we've done at Veterans Affairs. My last day at VA was April Fool's Day, 2016. I am now trying to live a retired life, but we'll see how long that lasts. What I wanted to talk to you a little bit about today is the work that we've done at VA and the changes that we made along the way. It's truly about a journey to improve what we started out with was access for our veterans to what we provided at VA, but is now truly about the veterans' experience, and I'll talk a little bit about that. This slide really represents where we are today, so I'm going to start here and work my way backwards. As part of the federal government, all of the administrations in Washington are measured. It's hard to believe sometimes, I know, but there's a website that you can all go to called Performance.gov. And each agency or administration has a set of agency priority goals that they set. There's been a lot of news and talk about what's been going on in VA. And so this journey that I'm going to talk to you about started in 2010. But as many of you know, we hit a big bump, a terrible bump, and a new secretary came in. And with that, he came from the business side of the world. He came from Procter & Gamble, Secretary McDonald, and he brought really the focus on veterans experience. So in FY16, our agency priority goals became very focused on veterans experience. And as we all know, if you can't measure it, it's not worth having a goal. So with this, the improvement is that by the end of September 2017, he would like to hit a point where 90% of veterans who use the services, and I'll talk a little bit about that in a second, who those are, come back and say that they've had an effective transaction or experience with the VA. They got what they needed. They got an answer. They got good health care, that it was easy to deal with VA, and that they felt like they were a valued customer, they were engaged. So a little bit about this transformation. We started in 2010 with a program called Veterans Relationship Management. I wasn't actually the first director of that program. I came in as a consultant. I told my husband I was leaving Boston to go to Washington for 3 months to help some people sort of straighten out some things around call centers. I got hooked. I went to visit a call center my first week in Philadelphia and realized there was so much potential to make a difference. So I began work in 2010, and the program, Veterans Relationship Management, which has now become the MyVA program, Veterans Experience Office, started then. It was started by a group of folks that saw the potential of what we could do, but starting from scratch. There was no infrastructure to speak of that would support it. We had to build all of that. A little bit about VA before I get into the gory details. There's 3 different administrations within the Veterans Affairs Office. Health, which is, as they call it, the 800-pound gorilla. That is where the majority of the employees are. It currently is one of the largest healthcare organizations in the world. There are about 6 million veterans that are actively engaged at any time in that program. Benefits is all of the benefits that are provided for a veteran outside of healthcare. And there's disability compensation for those that were injured while they were in service. There's pension, especially for those who are of low income veterans, mortgage, education, and several other things that go on from there, and cemeteries being the smallest administration. There are about 330,000 employees at VA, and this program that we put together was really to look at the enterprise across health, benefits, and cemeteries. There's also hundreds of locations. When we talk about medical centers at VA, there are 150 medical centers and about 1,000 local clinics and a variety of things in many, many towns all across the country. And the infrastructure, as I said, was old. There'd been many, many years before 2010 that not much has been done to any of the systems. In fact, many of the systems were built in the 70s and 80s. And so when I went to that call center for the first time, when a call center agent was looking up status of a claim, they went to 13 different systems to try to get an answer. So you can imagine that if I went in one order and the next person who answered the call went in a different order, we would get different answers. So there was no trust, there was no actual accuracy in what we were doing. The last bullet on here, and as you can imagine, it's quite an interesting time in Washington, but compliance, policy, and budget appropriations are not controlled by the organization. It's a very interesting world in which to operate. And I didn't even put politics on this slide, but it's a very difficult environment in order to make progress. So a little bit about our program, Veterans Relationship Management. We really wanted to build state-of-the-art tools and give the folks at VA the opportunity to be able to provide services for veterans. We also wanted to give veterans the opportunity to take care of themselves and to be able to get to their records that they owned and be able to do the things they needed to do. So we had multiple components to that. Voice access modernization. We replaced huge amounts of phone equipment, telephony, technologies. We put in the first national queues across VA. Before that, all the calls were answered individually. We did over last year, before I left, 80 million calls that we actually knew about came into VA on an annual basis. We believe that it's actually closer to 140 million calls if you add in all the calls that come into the hospitals as well. Those are still being worked on as we go through this journey. So we had call centers. We revamped all the call center software. There are 49 national call centers within VA. Some of them are small, but some of them are very, very large, and they're distributed across the country. We worked on self-service. And I'll talk a little bit about how we used eGain on the self-service side for chat, but we've automated the claims process on the benefits side. And now, it was just announced on Veterans Day, you can now enroll in healthcare without having to have a wet signature. And for anyone who knows how difficult that is to do in the federal government or any place where there's a lot of legal compliance, that was a big step forward. So the progress is being made. Data platform integration. I think Ashu spoke a lot about data. It's so critical in these environments. When I talk about 13 back-end systems that we had to get data from, the first call center application we built, we had 47 different sets of services that we built to pull data into the application. 47. It was crazy. People thought it couldn't be done, which was a great challenge for our team. We took that on as a big challenge. And finally, identity and access management, because as you all know, when we talk about any kind of personal data, especially healthcare data and financial data, understanding how to take care of it. So these were all the elements of our program. Where did eGain fit in all that? eGain was selected in 2010 as our knowledge management tool. And in 2013, we rolled out the first release of our knowledge management tool in the call centers to about 800 agents on the benefits side. It was the first time that we had actually put all the data together. There were many steps in that process, including establishing a governance process, establishing who were the owners of all these documents, and a huge culling of documents. We had to clean out many, many things. The Undersecretary of Benefits at that time saw a huge benefit in that, and so the next step in that was to take all 6,000 to 7,000 documents that we used for processing claims, disability claims, and putting those into the knowledge management platform as well. It was a very interesting time. They wanted it done. She first said she wanted it done in 2 months. So we rushed around and got that up and running, and it took them 8 months to clean the data, and they had 24 people working on it full time. But all of that is now in one place. The neat thing about it is it can be accessed by our partners, the veteran service organizations that help us with claims, states and county government officials that also work with us also have ability to access that. In addition, there is a version of that available for all our veterans on the SelfService platform. And the cool thing that we did is the way we tagged that data is that the version that's shown to the veterans is a lot less technical. It gets to we simplified, and it continues to get simplified down using a lot of the data that we see of where people are getting stuck and where there's issues to move that forward. So we did that as well in 2015. In 2015, the new secretary, Secretary McDonald, once we established the Veterans Experience Office, said to us, you really need to get rid of all these phone numbers. We had over 1,800 phone numbers. Now that program and that problem has been around for a very long time. And you can ask many people who work at VA how many times we've tried to solve that problem. So one of the things, because we had already started putting a lot of infrastructure in place, we knew we had an ability to do something unique. So what we did is create a new number for those people who didn't know where to go. And I'll use an example in just a few minutes to explain that to you. But if you already knew that for pension you called this 800 number and you knew how to do that and you were okay with that, we didn't want to try to take that away and make it more complicated. As I said, there were 1,000 numbers. It would take us a very long time. But we did create 1-800 number that could be used for those people who didn't know, who could use almost like, if you think about it, a concierge service to figure out where they were going to go. That was a challenge that we had, and that challenge was given to us before I left, so it was about a year ago. And he said, of course, it had to roll out by Veterans Day this year. So this is a little bit of a story about that. To tell you that story, I'm going to talk about a guided assistance call that would come into that 1-800 number that I mentioned when you didn't know where to call. And it's a very interesting case, and it's a very difficult case. And what it is when a veteran passes away and someone calls the VA to notify them that that person has gone. They could be calling for a whole bunch of reasons. I put a lot of them on here, but this isn't even all the things they could call for. So they could be calling for grief counseling. They could be calling to stop disability pension payments. There's a whole process around that you don't really want these people to have to think about at that point in time. They could be calling about burial. Veterans can be buried in national VA cemeteries, but they can also be buried in their own cemetery with a veteran, with a whole ceremony around that. There's the veteran flag, there's burial benefits. So there's a lot of things that people would have to know about. There's also a lot for dependents. So dependents often are using their family's educational benefits. So when a veteran has educational benefits, if they're not going to use them, they can pass them on to someone in their family, one of their children, for example. So there's a lot of questions around that as well. So with all of these things coming in, you can imagine people don't know where to call. So they're going to call into the MyVA 311 number. Now we have people answering that phone that certainly can't know about every single one of these things that's on here. So what did we do? Well, we worked with eGain and built out what we called a guided assistance for this particular area. And it was an exercise that went on with the eGain team and with the VA team. And so there was several steps in the process that we went through, designing the conversational guidance, understanding how it would work. And if you do get down to the booth and see how the guided self-service works, it's very similar to that process. It's just a lot more complicated. We also pulled data back from all the live data systems that we have in place using a set of APIs and web services, so we get specific information about that veteran immediately. Then we started working on the process. How could we streamline the process? Why does a person who calls have to know all the things they have to do? Why aren't we telling them in advance so they don't have to think about it? So that was a second part of this process, is figuring out how to put those pieces in. And how can we immediately answer some of the questions without having to spend a lot of time? So all of those things are things that we worked on as part of the program. The thing that Ashu also mentioned is, of course, we're collecting data all the way along the way, and there's an audit trail for all of that. So we can put all of that into our CRM system. We've already linked eGain with our CRM system, so we have a full contact history record. The nice part about that is these calls can go on for quite a while. If an average handle time is 5 minutes, these calls last from 12 to 15 minutes. So someone may not be able to complete their call. Using guided self-service, wherever we stopped in the process, that gets noted, so that the next time the person calls, whoever answers that phone can bring that call to completion from the place where they had left off, not making the person go all the way back to the beginning again. That's a pretty key piece of that. And looking at the data and understanding how we can fix it. In some ways, what we see is that it's a very complicated process that's still too complicated. So now we're looking now to simplify yet again how to make it simpler. So that's all work that's going on right now. That work was done with the eGain team, as I said, and will continue on. So what's next for eGain in VA? There's a lot of work to do. If you think about that one VA number, what other processes do we want to put there? What other processes do we want to put at the front of this concierge service? How can we make it, if you go back to the goals, easy, effective, and make a customer feel valued? Knowing who they are is pretty key to that. So moving all of that data up into the front of this process and being able to answer the questions after that. And also looking at the self-service process, vets.gov is relatively new and is really sort of the move to the new digital transformation model for VA. How do we push more knowledge up there? Well, we want to use virtual assistants and think about how that might be the next step in improving self-service at VA. So without VA and eGain, without eGain's partnership at VA, we would have really been stuck. We go back to 2010 when we selected eGain. It was a fight. We did a sole source contract because we believed that they were the right product and the right partner for us. Took probably 6 months to get through the procurement office. But we really think it made a big difference for us. The things that I would probably want to reemphasize here is, no matter where you are, I sat at lunch today with a variety of folks that were in all different stages of looking at customer experience and customer service and the things that they might want to do. One of the things I would say is we started at ground zero. We had not much to work with except very old infrastructure. The thing that I think was very useful to us about using eGain is their components and the platform that they bring to the table are the things that allowed us to go quickly. So knowledge management for us, if we had tried to do it in another fashion, would have taken us forever. So it was a proof point for us, a very important proof point, and we had the rest of the VA staff sort of trusting us once they got to see that. So now, you know, the goal is all those medical centers and all of those 330,000 health employees are now planning to move to one standard knowledge platform. The year or the days of VA saying every hospital is, you've been to one VA hospital, you've been to one VA hospital, we're really trying to change that. Registration is getting better. And the last piece of that now is to get everyone onto a standard platform, and that is one of the goals. So I want to thank you all for your attention, and I wish you all a good afternoon.